Welcome to Global Health Science study series with your Global Health partner, Andrew Charles Itoro. Today we are talking about PSA. PSA in full is prostate-specific antigen. This is a glycoprotein majorly produced by the prostate gland, which has majorly two functions, whereby one of them is to liquefy semen after ejaculation, then two is to enable motility of the sperms for fertilization across the female reproductive system. Then we also realized that in medical, there was an added significance of this glycoprotein, which states that it is also used as a biomarker for prostate infection or prostate diseases, which can include BPH, which is benign prostate hyperplasia, cancer of the prostate, UTI, and inflammatory conditions of the prostate. All those can be a differential diagnosis. So today I'm talking about the significance. Why do we need to know about this PSA, and what conditions can lead into an increase of PSA, which is prostate-specific antigen? One of them I told you is the prostate cancer, then the BPH, prostasis, which is the inflammatory condition, then the UTI, then recent ejaculation, and majorly a recent prostate examination or biopsy, which can be maybe called DRI, which is digital rectal examination. So why do we need to test for PSA? In general, we test for PSA in order to screen for prostate cancer in males. We also do it in order to investigate UTI, which is UTI that is ascended or advanced UTIs. Then we also do it in response to monitoring treatment of those patients who have been diagnosed with prostate cancer. We also use it for diagnosing reoccurrence of prostate cancer after treatment. Then we also use it to assess how the BPH or the prostatitis is coming about. So those are the major key reasons. So I want to let you know that PSA or prostate-specific antigen is not cancer-specific. This is organ-specific. That means the moment you find that there is an elevated level of PSA, it is not specific that the person has got cancer because of the previous differential diagnosis that I've listed to you. So you must know that there are so many other tests that we do in order to identify conditions or diseases associated with PSA, which may include the following. One of them is DRE. DRE is what they call digital rectal examination. This is a physical examination that is conducted by the clinicians or the doctor in order to identify enlargement of this prostate gland. Then, of course, you also go ahead and do what they call the PSA, which is a prostate-specific antigen test that we can also do that can give us an enlightenment of different ranges based on age bracket. Then also, after we have identified that there's an elevated level, maybe from around 4 to 10, which is non-specific in this area, we go ahead and do what we call the free PSA. So the free PSA will help to differentiate between the BPH and the prostate cancer. Not only do we do that, we also do what we call the multiparametric magnetic resonance imaging, the MPMRI. That one is also done in order to identify other things that are associated with the prostate. Then not only that, we also do what they call the gold standard, which is majorly called the histopathological or Gleason score in conjunction with the biopsies. This one is a histopathological procedure which is done in order to identify whether the prostate enlargement is due to cancer or is due to any other differential diagnosis. So we also go ahead and talk about the CT scan. The CT scan is used for monitoring extra prostate metastasis of this cancer, if at all it is cancerous. So before the procedure, there are pre-analytical steps that as a lab personnel or as a clinician or as a doctor should first know or ask the patient about. One of them, the patient must have not ejaculated in the last 24 to 48 hours. Why? Because recent ejaculation will lead into elevated levels of PSA. Then also the patient should avoid vigorous cycling, riding a bicycle for a long period of time. Due to the anatomical position of the prostate, it can trigger and lead to elevated levels of PSA. Then of course also we need to understand that collection of the sample should be before any other manipulative procedure has been done, like DRE. Samples must be collected before this. Then, of course, you also see that the doctor should also be informed that, or the clinician should be informed about the recent or the previous catheterization procedure of this patient. then of course the recent UTI treatment that the patient has gone through, then not only that, the recent prostate biopsy that must have gone through. So those are the pre-analytical steps that as a clinician or a lab person should first ask this patient or should be well acquainted with before the sample is collected. If your patient then meets the right criterion through which those questions have been spoken to them and they are the rightful patients where everything has been set into place, you go ahead and collect the sample. Now the sample is going to be collected on the ready top, or you can use the SST top, which is the serum separator tubes, or the ready top. After you have collected the sample on the ready top, you allow this sample to settle for a period of around 10 to 30 minutes. When you allow it to settle for around 10 to 30 minutes, this. So my kind reminder, if you have not subscribed to this channel, I request you to subscribe, like, and share, because this is going to be one of the basics that will provide enhancement for easy learning. Thank you so much, and I'll always be there to bring out to you. Wait for the next video on qualitative and quantitative analysis of these samples in order to bring out the best for you to help manage your patient appropriately. Always your global health partner, Andrew, bringing to you fully loaded information. Thank you so much.